Bowel assessment is another skill added to NMC OSCE skill station starting from November 2022. Are you preparing for OSCE after November 14th? Then, you should definitely go through this video and make sure you know to demonstrate this skill. This station is a silent station like fluid balance station. You will be given a Bristol stool chart in this station. Time limit for this station is 8 minutes. You need to familiarize yourself with Bristol stool chart in order to be successful in this station. In this station, you will be given one of the photos named A, B, C or D. Among the photos, A and B is usually formed stool, type 1 or 2, whereas C and D is loose stools, type 5 or 6. Henceforth, you need to correctly assess the stool photo and record accordingly in Bristol stool chart. Altogether, in this station candidate is supposed to complete the Bristol stool chart accurately, and signs, dates and adds time where required. Handwriting should be clear and legible. Also, ensure that strike-through errors retain legibility. Now, let's see how to write when you have been given different photos one by one. If you are given photo A or B, you need to correctly recognize Bristol stool type 1 or 2 appropriately and proposes plan of care to reduce/prevent constipation. Consider possible causes of constipation, such as medication, and explores potential alternatives. Offer dietary advice, increasing fiber, fruit and vegetables. Propose obtaining a prescription for laxatives. Consider dehydration and encourages increased fluid intake. Encourage physical movement where possible. Encourage not to ignore the urge to defecate. Promote positive toilet habits, privacy, positioning, breathing exercises, and spending time going to the toilet. Recognize the need to continue to assess bowels. To achieve full marks, the candidate needs to identify a minimum of 5 aspects of care. For partial marks, the candidate needs to identify a minimum of 3 aspects of care. If you have been given photo C or D, you need to correctly recognize Bristol stool type 6 or 7 appropriately and proposes plan of care to reduce or prevent diarrhea. Consider possible causes of loose stool. Food poisoning, overflow, medications such as antibiotics, healthcare-acquired infections such as norovirus or Clostridium difficile, or malabsorption. Consider infection control measures, patient isolation, sending sample for culture. Offer dietary advice, reducing fruit and vegetables. Propose obtaining a prescription of antimotility medication if suspected non-infectious cause. Consider dehydration and encourages increased fluid intake. Consider perianal skin integrity. Promote positive toilet habits, privacy, positioning, close proximity to toilets or commode and spending time going to the toilet. Recognize the need to continue to assess bowels. To achieve full marks, the candidate needs to identify a minimum of 5 aspects of care. For partial marks, the candidate needs to identify a minimum of 3 aspects of care. In order to pass this station, you need to by heart the interventions you need to provide for constipation as well as diarrhea. After all, the more you can bring back and write on paper from your memory, the more chance is there for you to pass this station. It's more or less like evidence-based practice station. Moreover, you need to practice this station by writing and make sure that you are completing within time frame of 8 minutes. If you like this video and you do think that this video definitely need to be shared with your friends who are preparing for NMC OSCE, please don't hesitate to do so. Our OSCE guide is now available in Amazon. Search for NMC OSCE for Overseas Nurses by Loveland Joshi. All the detailed article on NMC OSCE is available free of cost at www.oscetrainer.com. Follow us on Facebook at facebook.com/NMCOSCE. Please like, comment and subscribe to our channel, which will in turn motivate us to make more valuable content for you. Thanks for watching.